Greetings, everyone, and thank you so much for joining today's webinar, Medicaid Promoting Interoperability. Are we done yet? My name is Brianna Greer, and I'm the Program Coordinator for Hybrid Solutions. Many may wonder who we are and what kind of services we offer. Hybrid is Georgia's Health IT Center, assisting clinicians across the state of Georgia to promote interoperability through the successful use of EHR technology. We partner with various healthcare systems across the state of Georgia, DCH, GHIN, and many other community and professional partnerships. We are located at Morehouse School of Medicine, National Center for Primary Care. Our Executive Director is Carmen Hughes, and our Executive Medical Director is Dr. Dominic Mack. And I will go ahead and turn it over to our Program Manager, Selena Williams.
Good day, everyone. Thank you, Brianna. Our presenters for today's webinar is Liz Hanson, Health IT Consultant with Hybrid Solutions, Certified HIPAA and Privacy Security Expert, and she's also a PCMH CCE. Our other presenter is Francine Jackson, the Mapper Outreach Representative with Gainwell Technology, formerly known as DXC Technology. The webinar objectives today is as follows: overview of the program dates, review and tips on promoting interoperability objectives, review submission of documentation requirements, review common errors, overview and final tips for a successful 2021. So here are a few updates for program year 2020 and 2021. 2020 program updates and reporting requirements. Program year 2020 reporting period is any continuous 90 days, January 1, 2020 through December 31st, 2020. You must submit a 90-day PI dashboard, a 90-day patient volume calculator, and a 90-day clinical quality measure. In the past, you were required to submit a 365-day clinical quality measure report, but during this reporting period, you can submit a 90-day clinical quality measure report. The deadline for program year 2020 submission is May 31st, 2020. 2021, sorry. We don't want to go back to 2020. 2021 program updates and reporting requirements. As you guys know, the program will be ending this year in September, so you will be reporting for 20 and 21. So the program year 2021 submission dates are April 1st, 2021 through October 31st, 2021. Of course, it will be the same, the 90-day PI dashboard, the 90-day patient volume, and a 90-day clinical quality measure. We do not have the deadline submission at this time for the program year 2021. So stay tuned for any updates on program year 2021. I will turn it over to Liz Hanson.
Thank you, Selena. I'm going to talk a little bit about some of the things that we've come up or have seen as we've done some attestations for this year and some from previous years, because we haven't done a whole lot of them this year. So we really want to encourage you to get those done. We don't have a great many changes in the submission process or promoting interoperability that are different from previous years. As you needed last year, you will need to have your certified EHR technology number, your CERT number, and this is a number that could have changed from last year. So you do need to want to reach out to your vendor. What I recommend is you reach out to your vendor. You can look this up on your own, but we found that so many EHRs have modular components that are needed to build the CERT number that the easiest way and the most effective way for you to get this CERT number is through your vendor. And if you could get them to put it in a letter or an email, that would be great, because then you'd also have a verification of use if you asked for it. You will need, and this is something that we really don't normally talk about, but it is a little bit of a gotcha when you first get going on one of your first screens in the submission process. Now, I'm not talking about those screens as you work up to the PI category. I'm talking about once you go in and put your date ranges in to start entering your PI information, you do have some questions you have to answer. And one of those does ask for if the number, it's a numerator and denominator activity. It asks for the number of encounters during the 90-day period. and that's the denominator. And it asks for the number of encounters that were documented within an EHR, and that's the numerator. This sounds a little confusing, but most of the folks that we work with put all of their data into the EHR. And so it is usually 100%, but the number of encounters during that 90-day period does not show up on a dashboard. The number of patients is on your 90-day dashboard, but not the number of encounters. So that may be something you need to run on a different report to get. And a lot of folks get started and get bogged down just right there on that right in the first part. So we just want to give you a heads up on that. And we do recommend that you have your documentation ready with your scores visible. And I say this a lot to folks, and I don't think that I'm being clear about it. So let me make sure I'm being clear here. You need to be able to look at the report with the numerators and the denominators as you're inputting that data, where it will take you a great deal of time, and it's a little more subject to errors. So please, you could have it on a separate screen that you're looking at with side-by-sides or split. I wouldn't recommend split screens unless they're huge. Or you could have a printout of your dashboard, but have it somewhere where you can see it. And if you're having us assist you, then we ask that you send us a copy so we can be looking at it too. Okay, so we briefly just want to talk about the promoting interoperability objectives, those measures, and what the thresholds are. So the first measure is to protect health information, and that particular requirement is that you have done a security risk assessment. You should have a mitigation plan from that security risk assessment with dates of when you plan to have the issues mitigated. Certainly the security risk assessment needs to be dated, needs to have the practice information on it. Most standard security risk assessments, at least those that are provided at the federal level, have that information available, but you do need to be particular about how you export it. So this is something that we actually could help you with if you needed some help just in generating it, because of course it's after the year, so it's too late to do it for 2020. The second measure is your e-prescribe, and that you've queried a drug formulary. Most of you do have the drug formulary enabled. You want to make sure you have a snapshot of that during your 90-day period, and you have to have a score greater than 60%. Greater than 60%, not 60, greater than 60. A 60 would not pass, a 60.1 would. Number 3 is your clinical decision support rules. And these should be taken. These snapshots of your clinical decision support rules should be taken. We like to take them early in the attestation period so you can prove that you had them for the 90 days. Some vendors or some EHRs have a setup screen that you can go to and take a snapshot of when they were enabled, that they are enabled and what date they were enabled. And that's pretty handy, but most systems don't have it, have that available. These clinical decision support rules, which may be in the form of alerts, may be areas in a template that you need to fill in. They need to relate to 5 of these that need to relate to at least 4 quality measures. They could relate 5 to 5 quality measures, or you could have 5 that relate to 6 quality measures, but you have to have a minimum of 4 quality measures relating to those. 3B is your drug allergy interaction check. And this is another area where you need to take a snapshot of this or a screenshot, hopefully early in your 90-day reporting period. So we want to make sure you have that. And it's got greater than 60% and it's a yes, no. So ignore that. I don't know how it snuck in there. Now we have for A, B, and C, and these are computerized physician order entry. They apply to medications, labs, and radiology. And again, you have to have a threshold. You have to be greater than 60%. And so we want to make sure that everybody is doing these particular functions. And we rarely have any problems with these. And if we do, it's usually a practice that has less than 100 in the denominator, which provides an opportunity for an exclusion. Number 5 is patient electronic access to the health information and the access to API. This has to be greater than 80%. I will admit that this has been a struggle for some practices. in our one-on-one conversations and in previous webinars. We've talked about many methods that you can work on to improve this number, and we do know that it's a challenge, but you do have to have greater than 80%. I will tell you that a high number means that you've got a lot of very active patients, and the more active the patients are in their health, the better everyone will be. So we encourage that activity for many more reasons than just this. 5B is patient education through the portal. That's greater than 35%. And although we struggled with this for a couple of years, I think most folks have this one firmly under control. Then we have the coordination of care through VDT or API. And this is the second time you've seen API mentioned. And we've done sessions on using a third-party software to access your portal or to get to your portal and download information. We've talked about how you have to make sure you're giving instructions to all your patients on how to access your API and what applications are available for you to use that programming interface. VDT stands for view, download, and transmit. And I have had some practices think this meant that a patient had to send their record to someone to get credit for this. And that is not true. All they have to do is access their records, and that counts as a view. They make a copy or download it or print it, that's the D. And then if they send it to another provider, that's the T. Or they may transfer it to another application. So these are easier than they seem, mostly because most patients, if they do it, then they're familiar with it. You're not going to have many. They're going to ask you for API. Doesn't matter. You got to provide it. These are very small thresholds, folks, greater than 5%. So the reason I say these are not that hard to achieve is because you just need to buckle. You can almost muscle through 5%, 5.1%, okay? And we can give you some advice on how to do that, and we have in previous webinars. 6B is send a secure message, and that needs to be from the provider to the patient. 6C is the patient-generated health data or data from a non-clinical setting. So this measure would include if a patient had a blood pressure cuff at home that was integrated into their computer perhaps, and they took their blood pressure every morning and it automatically uploaded into the patient portal, or they went into the patient portal and entered that data. I have to admit, we don't have a great deal of patient-generated health data happening, but we anticipate that this is going to greatly increase in the next 2 years, and you're going to be way ahead of the game. 7A is health information exchange. And this has been a challenge for many practices, but it's getting better every year. It's almost getting better by the month. So this is where you create the summary of care, the continuity of care document, and you send it electronically to the practices you are referring the patient to. Okay. We have had some people say they've had issues with this being tracked because they're not getting a responsive ping or a response from the other EHR saying, we got this. And so there are some areas or some things that we can do about that. We'd be glad to work with you on it. Of course, that would only be good for 2021. 2020 is over. The next measure is HIE, receive electronically that summary of care and incorporate it into your health record. And 7C is that you reconcile the medications, the allergy, and the problem list when you get that electronic summary of care or continuity of care document. Now, let me back up and point out that the thresholds for this, the first one is greater than 50, the second one is greater than 40, and the third one is greater than 80%. And that seems high, but it's perfectly legitimate, because if you receive an electronic summary of care record from another practice, you're not getting the real benefit from it, the advantage, the good that it can do for you and your patients if you're not reconciling. If you're not incorporating your EHR and you're not reconciling, you're not really getting the benefit. And quite frankly, we have enough practices that think they're just jumping through hoops, checking boxes for no reason. And there's great reasons for this. And this one is one of the best. So you do have to attest to all three of these. you have to meet 2 of them. You can't meet one, exclude one, and fail one. That does not work. And I'm going to talk about that a little bit more in just a minute. You know what? Can you back up, Brianna? I think I failed to mention something. I did. On 6, I should have said that you have to attest all 3, meet 2. Okay, so needed to say that right there. So in other words, if you fail one, pass one, exclude one, that is not meeting 2. The public health or clinical data registry. Now, some of you, this may be a little bit different than what you're used to this year or in the past couple of years. You do need to make sure that you have done the research and that you have done your due diligence, because you need to attest that you're participating in 2, or you need to attest that you're participating in, that you're actually participating in 1 and exclude from the others. But you do have to address every area of the public health and clinical data registry. Okay, so that's a little different from the past. And so we just want to make sure that everybody's comfortable with that. And of course, we want to make sure ahead of time that you've done your due diligence. That due diligence needs to be accomplished by the first 60 days of your attestation period. So what that means, if you're looking to attest in 2021, it'd be a good time to work on that right now. Also required, we have 6 CQMs, or quality measures, for the same 90-day date range that you use for promoting interoperability. You should include 1 outcome or 1 high priority measure, and there are no thresholds. So you don't have to be greater than 60%. Of course, we would prefer that you were, but there are no thresholds. Okay, now we get to the submission documentation. Sorry to get excited, but I like having a checklist. Okay, so the first thing I have on the list is the verification of use letter. Now, this is something that was absolutely a requirement, and we would upload this in the past, not necessarily a requirement that you have to upload anymore. We recommend that you go ahead and get that verification of use letter, because it does contain the correct cert number. So go ahead and ask your vendor for that. It's a good thing to have in your file. You'll have backup proof. It's a good thing to have in your audit folder. So go ahead and ask for that verification of use letter from your vendor for the 90-day reporting period with your cert number in it. Of course, you have to have your patient volume calculator greater than, meeting the threshold of greater than 30%, unless you're a pediatrician, and that would be greater than 20%, and your payout would be less. It needs to be saved as an Excel or a PDF. I think most of us prefer the Excel version, and it needs to be less than 4 megs. Sometimes folks have a problem saving this in a higher resolution. It doesn't need to be in a high resolution, so it should comfortably fit in 4 megs. The next item we have is the detailed encounter report. And this is the report that lists all of the encounters and what their coverage was, what their insurance coverage was. And of course, you need to have those subtotaled. You can subtotal the commercials together, but the other areas should have their own subtotals. Now, again, you could put this in a spreadsheet or a PDF. I prefer the Excel. I think most of us do. If you put it in a PDF, you need to make sure that you've subtotaled and it's clear what you've done, and you need to have a summary page, because if you're putting it in all these will not fit, I don't believe, in one PDF. And so it could get a little, or even if it is, it would be awkward to work with. So make sure you've subtotaled and carried over those subtotals from every payer and have a summary page. On Excel, I still recommend subtotals, and I still recommend the summary page. It's just easier to get to them and view what you need to. And again, less than 4 megs. The security risk assessment. Now, if you've done the spreadsheet version that a lot of folks that we work with use, then you could just upload that whole document. It includes your mitigation plan, your dates. It should have the name of the practice, the provider, should have everything you need. If you use the version that is an online version, or the version that you use off of the CMS website from IT Help, that one you might need to work with to get your mitigation plan in a format where you can upload that. and we'll be glad to help you with that. Promoting Interoperability Report. This is your dashboard or your scorecard. Different EHRs call it different things. 90 consecutive days in 2020 generated through your EHR. I know some folks will send me a spreadsheet or will send me an Excel version of their report. Don't like it if it doesn't have a logo or something to prove that it came from your EHR, because anybody could do a spreadsheet with totals. So if you're using the spreadsheet version to read your numbers off of, then at least take a snapshot of this in the EHR so you have proof that it was the EHR generated version. And it can be in PDF or Excel. For this one, I actually prefer PDF. The next one is your clinical quality measures report. Different this year because instead of 365 days, we just want that 90 day. And folks, when we say 90 days, we mean 90 days, not 89 days and not 91 days. It needs to be 90 on the nose. For your reporting for promoting interoperability, generated through your EHR and saved as a PDF or Excel. Make sure that you have proof of 4+ clinical decision support rules, or 5 clinical decision support rules that match at least 4 of these. Make sure you've got that. And I like to make a little note of what those are going to be, because you want to make sure you use, I've seen folks that got them a little scrambled and we're going to use different quality measures than they got clinical decision support rules from. And that's not good. So we want to make sure we're consistent and make sure that you can prove that these were enabled during your reporting period. So here are some screenshots or some discussion about your yes/no measures saved as a PDF. We've actually got a sample here of some clinical alerts. So these clinical quality measures, an alert or clinical decision support rule that goes with a clinical quality measure. So yes/no measures need to have screenshots. Your 5 clinical decision support rules, your drug allergy interaction check, your drug formulary check, your GRITS screenshot. If you are utilizing GRITS, you should be able to go into your EHR and easily take a screenshot that shows that you're submitting electronically. I do want to say that if you're submitting GRITS by logging into the GRITS portal and entering it, that's not an electronic submission. You want to make sure that you've got documentation for your exclusions or proof of the activity. So if you're taking an exclusion for CPOE, then the reason should be you have less than 100. The same should be true for your HIE exclusions, and the same is true for your registries. You need to document, approve, provide some kind of visual proof that you're either participating or that you should exclude it. So due diligence documentation, letters, for example, if you're pediatrics and in Georgia, there's not a registry available through the Association for Pediatrics, not available, and they'll send you an email telling you it's not available, which is very convenient. So you need as much proof as you can get to prove that you did your due diligence and it did not apply, and you weren't eligible or could not participate. You do need to have your proof of application programming interface, your API documentation that you provide to your patients. You want to make sure you've got a copy of the instructional documentation, as well as the list of applications that are available. So just want to make sure you have that. Don't know that you necessarily need to upload it, but since it needs to go in your audit folder, it's on our list. So here are just a few tips. We want to make sure that you are mentally prepared for your attestation. I want you to understand that first one you do, it could well take you an hour. Okay. We don't want you to try to go fast through it. I'm going to talk in just a minute about some of the questions that we have some folks that they're just not reading these questions thoroughly and they're not answering them properly and they're being rejected. And we don't want that to happen to you, especially as we get towards, where the program is closing out. We need to submit our attestation and make it go smoothly through approval. If you get this right the first time, it'll be faster. So be ready, have your information ready, have visuals ready so you can see your denominators and numerators. Set aside the time for uninterrupted effort. Yeah, that's easier said than done these days, folks, but it will take you much longer if you have to start and stop because it requires some focus. And remember, you are only doing this once a year. So it's a little strange every year. Now, if you're submitting for 15 providers, wow, I'd like to help you. But the subsequent ones will get faster. Okay, but that first one, go slow. Take your time with it and get it right. And of course, we'll be glad to help you if you need some assistance. Have someone back you up if you can. If you can have somebody sit with you or share a screen or share the screen and look at their numbers to double check you. It's a little bit less stressful. I've said this 2 or 3 times. I'll say it again. Have a visual of your PI dashboard and your quality measures. Have your certification number available for copying. I know that sounds so silly, but it's a very long number. And we don't want you to get it in wrong. We don't want you to put it in wrong. So I usually have folks just open up their verification of use letter and copy and paste the cert number so we know it's right. Have all of your documents uploaded in a separate folder, a subfolder so you should have your 2020 audit folder, and then there should be a subfolder of that are just the documents, final documents you want to upload, especially if you've got multiple providers, because it just gets a little confusing when you have 50 documents, but you only need to upload 10. So let's make us a subfolder and e-folder, and let's put the ones we want to upload in there. Name your document so that someone can tell what it is. And of course, that someone is the lovely Francine and her team. I understand that your inclination is to name it something that you will recognize and identify with. If you need to put that on the end, okay. But please name them something logical so that the person vetting your application or your submission can tell what it is, okay? That actually seems to be a bigger issue than I had anticipated. Make sure that your document naming extensions are acceptable. You can't upload a JPEG. It won't take it. And you may be trying to do your submission and you're uploading and you're trying to finish and you can't understand why it won't take that document. 9 times out of 10, if not 10 out of 10, the problem is the extension is not an acceptable extension. Remember, you cannot upload the PVC in its macro format. You must change it to just an Excel format without macros. So this isn't going to take you a lot of time, but it'll save you some frustration when you get in there to do it. And of course, make sure your document sizes are acceptable, less than 4 megs. Okay, I've said this before earlier, that we want to make sure that you answer these questions carefully. Because they're a little confusing and they kind of switch from a negative to a positive pretty quickly. And so make sure you're reading. The first one, do you and your organization acknowledge the requirement to cooperate? Well, yes, of course you do. And if you say no, you're going to be rejected. But it's important that you understand that the federal government is trying to make sure that the vendor data is good, that your data is good, that we're just approaching that open notes period that will start in April. So we want to make sure that this data is good, it's robust, it's clean, and that you're not trying to block any information from anyone that needs this, be it the patient or another approved provider. So read them slowly, read them carefully. Let us help you if you're concerned. Whoa, this one jumps out at you. And I had to thank Selena for the next 3 slides. And these were from last year, so they're not this year's, but the same things could happen to you this year. This particular application was denied. Let's look at question 1. They have a yes. If you look at question 1, now there's multiple portions, so there's more than one question 1. This question 1 said, did you or your organization knowingly and willingly take action to limit or restrict interoperability? Now, you were used to saying yes, 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 that you'd allow, you allow. And then we get to this section that says, did you knowingly and willfully take action? to restrict interoperability. This person put a yes. Yes is not acceptable. If you knowingly and willingly did it, that's the opposite of what you were supposed to do. This should have been a no, but they put yes, so it got rejected. So you need to read carefully and make sure you're interpreting the question right. Many of you will remember them from last year, but some of you are new to doing this and you're not going to remember them. Please be careful. You'll notice they did answer the next section good, but one rejection is a denied application. Next slide, please. All right. This one, we got an inquiry from a provider's office because they wanted to know why did they get rejected. Well, they got rejected because the threshold was greater than 24.65%. So if you fall below the threshold, you're going to be rejected. It's going to reject the application and you're going to fail, or it's going to reject the numbers and you will fail. You'll notice that this one actually had multiple ones. And this is just not this is just not a passing scorecard. And we should have been working with this person in January of last year. So don't let this happen to you. Let us help you. Next slide, please. Oh, this one's just hurtful. Okay, so this is the one where this is one of the objectives where you had to be able to do, you had to meet 2. You had to report 3, meet 2. Well, this practice didn't meet any. So obviously, if you don't meet them, you're going to fail. But what is sad about this one, or what concerns me about this one, is they could have taken the exclusion for the first one because their denominator was only 36. They could have taken the exclusion for the second one because their denominator was only 2. They could have taken an exclusion for the third one because their denominator was only 6. But they didn't. And they got rejected. So folks, please let us help you with these. All right, and I think this is about my next, about the last slide that I have. And this is just something that it just catches me unaware from year to year if I don't think of it. And this is the checkbox that if none of the outcome or high priority measures apply to your practice, then you need to acknowledge and check that box in mid-page that none of the outcome clinical quality measures above apply to your practice. Otherwise, you'll spend 10 or 15 minutes going in circles trying to figure out why it's rejecting your quality measures. So again, I know you'll figure this out, but I'm just trying to help you, save you from a little frustration as you go through it. And I believe that's it. And I'm going to hand it over to Francine to take it away.
Thank you, Liz, for that very valuable information. And now let's go on over to the common provider attestation errors. Providers, what you must do when you complete your application is to make sure that you are taking your time when you are completing your applications. This is a very common error that we see a lot of providers make, and this is the mismatch error. What this is stating is that the information, meaning the demographic information that you have in GAMIS, is not the same as what you have entered in CMS. Let's take a look further. On the left-hand side, you see that the Social Security number is 4567, and it shows on the right-hand side when it says the National Level Registry. Well, that's the CMS National Level Registry. As you can see, the very last 4 digits are correct, but somewhere in there, the Social Security number is incorrect. The next error is the extended part of the zip code. You must put extended part on there. For example, the first example shows that in the Georgia Medicaid system, this provider has 2493 versus what's in the National Level Registry of 2467. So that extended part of the zip code is very important. The current service location, as you can see, this provider's in the A location, but what happened is that this provider should be logged into the B location. As you can see at the very bottom, it says service location is currently able to access Mapper. That is the B location, and it says yes. Okay, here's another common error, the yes, no button. When you're actually on this tab, this is the Get Started tab. And on this tab, if you actually enter information such as the NPI number, the address, all the demographic on this actual page, and the information is incorrect versus what you have in the national level registry, if you click yes, that means that you're certifying this information that you have entered into Mapper is the same exact information that's on the CMS national level registry. If you click yes and the information is incorrect, then you will actually get a message at the very bottom of the screen that says to please revert back to CMS. Now, you as the provider will actually know what is correct versus, if it's on the CMS that needs to be corrected, you need to correct it on the CMS side. If it's something that you need to correct in the GAMIT system, then you need to actually go to the GAMIT side. Now, if you are correcting any information in the CMS National Level Registry, you want to actually wait 48 hours before coming over to the Mapper system. And this is because you need to make sure that the system is actually having time to update. So wait 48 hours before you come into Mapper to finish your application. All right, so this is a common error. It says the MMIS system does not contain a payee record for the NPI and the 10 combination received from the RNA. Now, this can be kind of confusing when you see the word received from the RNA. That means that is information received from that national level registry. On this particular error message, the provider put in the incorrect payee 10 or NPI. Now, you do see a continue button at the very bottom. However, if you click that continue button, it'll allow you to go all the way through with the registration. However, you must not submit this application because you would actually need to make sure that your information is correct. If you submit this your application and the payee 10 and the NPI is incorrect, then this actual application will deny and you will not be able to attest until the next program year. And this error message is the incorrect RNA number. We have a lot of providers that either forget the RNA number, or you may be a new provider that's coming into the office. I'm sorry, not a provider, but a provider contact that's actually new at entering applications. And a lot of times the RNA number may not have been given to you from the previous person. In this case, you can actually get the RNA number from the CMS National Level Registry, or if you contact our Mapper team, we may have you authenticate some information, and then we can actually provide that information over to you. For this particular error message, this means that there are no applications on file with the provider ID number that the individual input in the system. And in this case, you would just basically check your records to make sure that you can actually verify which provider ID have Mapper applications associated with it. Once you find that information out, go ahead and go into Mapper, put your RNA number in, and start your application. Okay, and this is the most common error message that we have. Now, this is just a screenshot of the CMS National Level Registry. Now, we don't own this page. This is just a screenshot to show you exactly what it looks like. This is, this error message occurs when the provider contact forgets the username and password. Sometimes, again, it could be somebody new coming in as a new provider contact, and they're in charge of entering the applications or updating information on the CMS National Level Registry. And if by chance that you forget the password, then you actually can log on to the PICO's website, or if you call the number listed below, it's only going to tell you the steps to upgrading the password. And these are the steps as far as to change the password. You're going to log into this PICO's website. You're going to click Forgot Password. This is actually going to take you to the INA system website where you would actually reset your password. Now, that same password that you use on the RNA system I'm sorry, the INA system, that same password, you're actually going to use it when you log back into the CMS National Level Registry um, to update your information on CMS. All right, so this is the exciting part. This is the question portion of our webinar. And at this time, I'm going to actually turn it on over to Selena Williams.
Thank you so much, Liz and Francine, for all that wonderful information. If you have any questions, please put them in the chat box. Okay, I don't see any questions at this time. Liz or Francine, is there any additional information that you guys want to share that will be helpful? Any questions that came through the registrants list that you guys wanted to address?
This is Liz, Selena. I did want to make sure we had someone on the registration list that wanted the checklist of the documentation, and that is something that we have available. So if that's something that you'd like for us to help you with the submission, or you'd like the checklist, then that is something that we have that we'd be glad to provide. And I think the other two questions that came in weren't really applicable to today.
Sounds great. Francine, did you have any additional information you wanted to add?
Additional information I wanted to add is that to please make sure that you start your applications now. The deadline to be here before you know it. You want to make sure that you are making sure that you have your documents correct, asking for help if you don't understand exactly what you're doing, because we want to make sure that you get those applications in on time. And because there is a hard stop on May 31st, 2021, which is the deadline for program year 2020. So go ahead and get started now to make sure that you are completing your application on time. And that's all I have.
Thank you so much, Francine. Okay, I'm going to turn it back over to Brianna Greer, and she's going to close the presentation out for today. Thank you all for attending.
Awesome. Thank you so much, ladies, for that wonderful presentation. It was very informative. All righty. So Highbridge partners with Format Approved to provide discounted continuing education and professional development opportunities. For more information, please visit www.formattrainingcenter.com/Highbridge Solutions. But also, please use the coupon Highbridge20 to receive a 20% discount. Here are additional resources for you all, should you need them. So I'm gonna kind of wait a minute to give you opportunity to write down or look at them. I also want to extend a huge thank you for joining today's webinar. Please be reminded that Highbridge Solutions offers a monthly webinar on every third Tuesday of each month from 12 p.m. to 1 p.m. Please feel free to contact Selena Williams at sewilliams@msm.edu, 404-752-1193. Again, thank you so much for coming, and we hope you all have a wonderful day. Bye-bye.